Hi everyone, my name is Mariah Alves and I am doing my project on ketamine. So what is ketamine? According to the Drug and Alcohol Foundation, ketamine is used by medical practitioners and veterinarians as an anesthetic, and it's obviously sometimes used illegally by people to get high. So, ketamine is considered a dissociative drug, which means that it causes people to feel separated or detached from their body or physical environment. Dissociatives are similar to psychedelics because they can cause hallucinations and other changes in thoughts, emotions, and consciousness. Ketamine is also FDA approved for medical procedures and medications. And later in the presentation, I'll be talking about how ketamine is actually used in mental health settings to help with depression. So, some of the ketamine effects on the body are listed here. Some of them include feeling happy and relaxed, feeling detached from your body, lowered sensitivity to pain, visual and auditory hallucinations, which include confusion and clumsiness, increased heart rate and blood pressure, drowsiness, slurred speech and blurred vision, anxiety and panic, vomiting, and lastly, going into what is called a K-hole, which is a very intense detachment from reality, but only really occurs when um, inhaled at a high dose. So, some of the methods of administration first is by an IV. IV reaches its receptors very quickly with a transfer half-life of less than a minute. Ketamine can also be administered through intramuscular IM, intrarectal oral, or intranasal routes, which is a nasal spray, and that's what they use when they do research on how ketamine can help with depression and other mental disorders. They give their patients a nasal spray. But going back to this, the IM route of administration provides a high bioavailability of 93% and results in peak plasma levels within 5 to 30 minutes. Ketamine quickly enters the brain and it has a plasma protein binding from 10% to 50%. These are just a list of some of the interaction with other recreational drugs. So, ketamine can have some unpredictable effects and have harmful risks when consumed with alcohol, opioids, or cocaine. So, ketamine and alcohol can cause nausea and vomiting at lower doses, but it also can lead to more serious effects of higher doses, such as passing out and vomit aspiration. Similar to alcohol, ketamine and benzos or opioids can cause nausea and vomiting, difficulty breathing, passing out, but even possible death. Ketamine and ice, speed, or cocaine increases blood pressure as well. So just a overview of absorption, metabolism, distribution, and elimination. I will let you read all about this scientific portion of the recreational use of ketamine. I did talk about how the IV provides a high bioavailability of 93% and a peak plasma levels within 5 to 30 minutes. However, oral ketamine has a significantly lower bioavailability of 16 to 29% due to an extensive first pass heptic metabolism. So, distribution, it quickly enters the brain and has a plasma protein binding of 10 to 15%, like I previously stated. The elimination half-life is typically 2 to 4 hours. After administration, most ketamine and metabolites are um, excreted through urine, which 91% of administered radioactivity appearing over 5 days. Only about 20% occur as the parent drug or major metabolites. So moving on to ketamine and mental health. In the past 2 decades, there has been a lot of research done with ketamine by a step anesthetic dose to have rapid and sustained antidepressant effects, and accumulating research has demonstrated ketamine's therapeutic effects for a range of different psychiatric conditions. So this is CAP, or ketamine assisted psychotherapy, where research demonstrated ketamine to have a short-lived anti-suicidal properties independent independently of improvements in depressive symptoms. Some evidence supports that it is beneficial effects of ketamine for post-traumatic stress disorder and obsessive compulsive disorder. And ketamine's antilogic effects for social anxiety disorder and generalized anxiety disorder have also been reported reducing symptoms. There is also evidence that ketamine results in short-term increases of abstinence, reductions in use, cravings, and symptoms of withdrawal related to public substance abuse issues. Continuing with ketamine and research, the research into ketamine demonstrated that it may reduce depressive symptoms, especially suicidal ideation. However, the cost of administration, along with potential cardiovascular and respiratory issues, does raise some questions, and further research should determine if this is a viable option for treatment. However, clinical trials and studies have assessed ketamine as treatment for depression and have shown good results. So currently, um, I cannot pronounce this name, so I'm just going to let you read it. But it is the nasal spray that I was talking about. And they give ketamine in the nasal spray to their patients for depression. And I did read actually in our textbook for our psychopharmacology class that they are doing these nasal spray treatments of ketamine in Australia. So lots of research done on ketamine, which I think is really interesting. But there are some delayed effects of ketamine, so just to keep in mind, this is for regular use of ketamine, not necessarily ketamine, excuse me, used for research for depression and other mental disorders. This is for illegally substance use continuously. So regular use of ketamine can eventually cause some flashbacks, poor sense of smell from snorting it, mood and personality changes, including depression, poor memory, thinking, and concentration, abnormal liver and kidney function, and ketamine bladder syndrome and abdominal pain. So, going more into what ketamine bladder syndrome is, it's a further, it's a further effect of ketamine that is basically like a bladder infection that is caused by consuming too much ketamine. So it's a painful condition needing ongoing treatment, which symptoms include difficulty holding in your urine and can cause irritation in the bladder. So basically, like a bladder infection. These are my references for all the research that I have put into um, this project of ketamine, and that is it. Short presentation. I hope you guys enjoyed learning about ketamine, and hopefully it sparked some interest for you to do your own research on it and look into the research that is done for depression, treating depression, and other mental disorders. I think it's really interesting. So, hope you guys have a good day, and I can't wait to read all of your presentations. Thank you.